So, hello all. So now we are going to discuss all the questions asked in MRB 2025 in a pharmacology subject. So it's pharmacology recall. So myself, Dr. Sudheer Prudhvi, I'm a Idea Plexus pharmacology faculty here. So now we'll discuss questions one by one in pharmacology subject. So the first question, anti-CD20 monoclonal antibody. So again, this is a very simple one as I already discussed it in the what you call lecture. So Ritu, Ritu already I told you, Ritu is a 20-year-old girl. She's a 20-year-old girl. So Ritu means 20-year-old girl, and it is a CD20 monoclonal antibody. There's an easy way to remember. So this is the answer here. So then what about the other? What about the other options here? Bevacizumab, this is a angiogenesis inhibitor, and omalizumab targeting IgE antibody, which is used in bronchial asthma. And the next cetuximab. So cetuximab, it is a HER1 antagonist or HER1 blocker. Human epidermal growth factor antagonist. That's all used in colorectal carcinoma. So that's all about anti CD20 monoclonal antibody. And this is a question which is present in our what you call workbook series, MRB practice paper and recap challenge. Question number 5. This is recap challenge 5 and question number 24. So this is direct question from MRB workbook series, and then sorry, MRB question bank series. So that's all. And coming to the second one. So what is the substance added to the vaccine? Added to the vaccine to increase the efficacy. Again, this is also a question from our question bank series. So here it is a adjuvant. Answer is adjuvant. It is the one. You can see it here. It's a MRP subject-wise test, PSM question number 9. Question number 9 is clearly it is mentioned here. You can see adjuvants are the substances added to the vaccines which enhance the body immune response. So this is what adjuvant. So then what about the other options here? So stabilizer, it is just used to stabilize what you call the vaccine during the transport. And then coming to preservative and antibiotic, they are just used to prevent the bacterial contamination. That's it, not more than that. So that's all. Now coming to the next question, Technosphere insulin also called as. So here, this also we have discussed it in MRB workbook. So it's like we can rule out the options here. First I'll show you the screenshot of our workbook. So this is what I have discussed here, what you call in MRB workbook series. So clearly here, all the insulins I have mentioned in a singular tabular column, which are short-acting and long-acting insulins. So this already I told you, long-acting insulins, they contain large in its name, or these are the drugs which starts with a D. So here you can see it here, containing large in its name. This is a long-acting insulin. This is a long-acting, and the insulin starting with a D, dating with this is also a long-acting one. And we know protamine, neutral protamine Hagedorn. This is also a long-acting one. So these three are long-acting ones, as already we have discussed here. Neutral protamine Hagedorn, glargine, detamir, all these three are long-acting ones. So obviously the remaining thing is Afrezza. This is what Technosphere insulin. This is what inhaled insulin. This is what inhaled insulin. So this is for direct question from a workbook. Direct question from our workbook. And this is what Technosphere insulin, inhaled insulin. This is what a screenshot from our regular notes also. Afrezza, this is a Technosphere insulin. Technosphere insulin. Remember, this contraindication is smokers and lung disease, because in these two scenarios we cannot predict the bioavailability. So that is the reason why these two are inhaled insulin is contraindicated in these two conditions, that is smokers and lung diseases. That's all. And then come to the next question. Approved drug for cervical ripening. So here, obviously, we can rule out mifepristone, because this is the one which is a progesterone analog. Progesterone. And alprostadil, we know this is a prostaglandin E1, which is useful to maintain patency of ductus arteriosus. Maintain patency of ductus arteriosus. So these two we can rule it out. These two are the options. Now coming to which one? See, the misoprostol we can use and dinoprostol both we can use, but misoprostol is the one which is the off-label one, and dinoprostol is the one which is approved and is a gold standard one. Again, this is also a question which is from MRB subject wise. MRB subject wise, what do you call practice thing, and OBG 41st question, for 41st question. So misoprostol, clearly we have mentioned here, is for cervical ripening, but it is an off-label one. Off-label one, but I'm not sure about this question exactly. But approved drug list, we can go for dinoprostol only. We can go for dinoprostol only because this is a off-label one. Off-label one. That's all. That's all about the cervical ripening part. Now come to the next one. Which of the following is a second generation fluoroquinolone? Fluoroquinolones typically we have five generation, but in short, easily we can divide into first generation and second generation. First generation includes all these three. These three comes under first generation. Ciprofloxacin, norfloxacin, and pfloxacin, they comes under, and ofloxacin also it comes under. Along with these three, ofloxacin also comes under first generation. Second generation includes levofloxacin, lomifloxacin, moxifloxacin, tarfloxacin, gutifloxacin, all the other drugs. So lomifloxacin is a second generation fluoroquinolone in this question. Now, next question. True statement about Cinacalcet. Again, this is also a question which is seen from MRB practice paper of 5, question number 90. You can see it here. MRB practice paper 5, question number 90. Cinacalcet. Everything is given here. Everything is given here itself. Everything is given here itself. Now you see, and this is what the same thing which is seen from MRP regular notes even. So Cinacalcet, it is a calcium mimetic drug. What it is doing, sir? It is going to sensitize the calcium sensing receptor. If sensing receptors are sensitized, what it is going to do? It is going to think calcium level is high. So it is going to decrease the parathormone. In what conditions we have to decrease the parathormone? Only in the hyperthyroidism cases, that are inoperable cases. So what is the most common area of Cinacalcet? It is going to decrease the calcium. It is going to decrease the calcium. That's all about every point about Cinacalcet here, which is already discussed. So now we can see here. So this Cinacalcet, it is a calcium mimetic drug. Yes, this is true. Parenteral given, no, this is false. This is what it is given orally. This is given orally. And it activates calcium sensing receptors. Yes, this is also true. This is also true. Activates the calcium sensing receptors. It doesn't antagonize the calcium sensing receptors. No, this is false again. So here in this question, these two are correct options, but I don't know exactly what is the exact question. So these two are correct as per the given question. These two both are correct. So calcium mimetic drug, and it is activates the calcium channel and is oral. It is not a parenterally given one. It is not a parentally given one. So that's all about Cinacalcet. And then coming to the next one, which all of the following are true about clozapine except. So again, this clozapine, it is again a direct question from our what do you call MRB workbook. You can see here clozapine adverse drug reactions. I told you, you can remember all the clozapine adverse drug reactions with the mnemonic CAM, I told you. So clozapine starting letters, it is close. So we can scam the people who are very close to us, right? When compared to the people who are not that much close, those people who are very close to us, we can do scam. That is what SCAM. S means siloria, also wet pillow syndrome. C, constipation. A, agranulocytosis, and as well as alpha blockade, and M, myocarditis, and metabolism. This is what adverse drug reactions of this clozapine. Again, direct question. See, yes, said a yes. In what you call in yes, it belongs to sedative also. What is the reason for sedative? It is due to histamine blockade. Yes, this is true. And then hypotensive effect. This is due to alpha 1 blockade. This is also true statement. This is true. This is true. And coming to the last one, least or no extrapyramidal symptoms. Yes, this is also true statement because this is a second generation antipsychotic agent. And coming to anti-emetic effect, yes, this is a false statement. So this will be the correct answer because but antipsychotics, all antipsychotics are anti-emetics. But I told you clearly, all antipsychotics are anti-emetics except this second generation antipsychotic agents. In the clozapine is the one, so it doesn't have this anti-emetic action. So that's all about this clozapine part. Now, Coming to the adrenaline dose for infiltration. This is also we have discussed in 2024 ADR Plexus 2024 workbook regular workbook. So adrenaline dose. Clearly here I have mentioned clear itself three ratios of adrenaline. One is to 1,000, next one is to 10,000, one is to 1 lakh to 1 is to 2 lakh. Clearly, you have mentioned. So 1 is to 1,000, it is for anaphylactic shock, and 1 is to 10,000, it is given in cardiac arrest IV, and then 1 is to 1 lakh to 1 is to 2 lakh, that is given in local anesthesia. Local anesthesia. So that is what infiltration anesthesia. So clearly, it is like infiltration. So 1 is to 80,000 or 1 is to 1 lakh, anything is fine. So option B will be the correct answer here. Option B will be the correct answer. That's all about this adrenaline doses. That's all about this adrenaline doses. Now, come to the hormones with intracellular receptors. Hormones with intracellular receptors. You see, intracellular receptors, these are nothing but nuclear receptors. Nuclear receptors. So we have discussed this nuclear receptor concept in a 2020 ADR Plexus 2024 regular workbook series, nuclear receptors in detail about these nuclear receptors. So let me tell you in short. So we have a cell. So we have a cell here, and we have a nucleus inside. You have a nucleus inside. So whatever you take, the following examples, they go on, they act on the receptor which is present inside the cell. That might be in cytoplasm or that might be nucleus. Wherever the receptor might be, but final action is at nucleus only. So now let's talk about the receptors which is present in the cytoplasm. Examples are corticosteroids and vitamin D. These two, corticosteroids, vitamin D, and the sex hormones. These three receptors, they are located in cytoplasm. And when coming to the nucleus, vitamin A, thyroid hormone receptors. Thyroid hormone receptors. These are present in the nucleus. So that's all about this part. Now we see nuclear receptors, obviously, glucocorticoids. Then what about the other options? The growth hormone, yes, we know these belong to JAK-STAT. And calcitonin glucagon, they belong to GPCR. That's all. That's all about these hormones with intracellular receptors. Glucocorticoids. This is what we have discussed, and this is also the growth hormone, which belongs to JAK-STAT, which belong to JAK-STAT. That's all. That's all about this receptors part. Now come to this. Which are the following drug causes coronary steal phenomenon? This coronary steal phenomenon. This already I told you in the class also. This coronary steal phenomenon. These are the drugs. What drugs they cause coronary steal phenomenon? Anti-drugs. If you have good handwork, you can steal someone's heart. So if you have good handwork, you might be a batsman, you might be a good bowler, you might be the person who have very good handwriting, or you are the person who can write a good letters. So if you have a good handwork, easily you can steal someone's heart. So that is what the mnemonic for the drugs having coronary steal phenomena. So what are those? H hydrolazine, A adenosine, N nitroprusside, sodium or sodium nitroprusside, anything is fine. Next, D dipyridamole, I isoflurane. That's all about the drugs which causes coronary steal phenomenon. In those, obviously, dipyridamole, handy drugs, D-dipyridamole. And what about the other options, sir? You can see rhinolarin. It is the one which blocks late invert sodium channels. And nicorandil. This is also we have discussed in the regular MRB workbook series. This is the one having, it is a nitric oxide donor as well as a CO. That is a channel opener. And then ibutylide. It is a class 3 antiarrhythmic agent. It is a class 3 antiarrhythmic agent. It is a class 3 antiarrhythmic agent. This is what direct screenshot from our regular workbook series. So coronary stream phenomenon, handiwork, If you have good handwork, you can steal someone's heart. And this is what we have discussed. You can rule out the options also. This is what we have discussed in Nicorandil. This is a nitric oxide donor as well as a potassium channel opener. This is what we have discussed. And then ibutylide, it belongs to class 3 antiarrhythmic drugs. It belongs to class 3 anti-arrhythmic drugs, ibutylide. So this is the thing which we have already discussed in a MRB workbook series. Now, come to the next question here. The patient has history of OP compound poisoning 3 days back. Now he came back to us with a very chief complaint of this proximal muscle weakness. So what is the diagnosis here? So clearly, see OP compound poisoning, everyone knows OP compound poisoning, antidote is atropine, cholinesterase reactivators, pralidoxin. But here, he has asked some other things, some extra edge. So here, OP compound poisoning, it is followed by, if it is followed by muscle weakness, maybe couple of days, 2 days, 3 days, 4 days. If it is followed by muscle weakness, there is one terminology. And if it is followed by some nerve issues, those nerve issues, it might be sensory disturbance. It might be sensory disturbance, or it might be some ataxia. If these are the conditions, so OP compound poisoning is followed by muscle weakness, followed by nerve issues. If it is having muscle weakness, then we call it as intermediate syndrome. If it is having any nerve issues, then we call it as delayed onset neuropathy. So clearly here in this question, they have mentioned muscle weakness. So obviously it will be intermediate syndrome. Intermediate syndrome. So this is what we have discussed in the ADR Plexus 2024 regular workbook series. OP compound poisoning followed by muscle weakness and sensory disturbance. That is what intermediate syndrome and sensory disturbance, or like any ataxia, any nerve issues. It is delayed onset neuropathy. These two are the terminologies which are followed by OP compound poisoning. OP compound poisoning. That's all about this OP compound poisoning question. And then the next one, the non-opioid drug that do not inhibit the prostaglandins. That do not inhibit the prostaglandins. So again, this is like there are a few outliers in the exam actually, which are not asked in the syllabus, and there are a few questions which are very rare things, and this belong to that one, very rare one. So non-opioid drug is an NSAID which do not inhibit the prostaglandins. All NSAIDs they inhibit the prostaglandins, but this NSAID which don't inhibit the prostaglandin is nifopam. This is the one which don't inhibit the prostaglandins, which don't inhibit prostaglandin synthesis. Okay, sir, fine. If it is not inhibiting prostaglandin synthesis, then how it is going to act? So nifopam, what is the mechanism of action? What it is going to? It is going to inhibit tryptamine, that 5-hydroxytryptamine, that is serotonin, and a noradrenaline dopamine reuptake. No, is there any contraindication of nifopam? Yes, definitely. Epilepsy. In epileptic patients, we cannot give nifopam. That's all about all the questions which are asked in MRP 2025 concerned with my subject, that is pharmacology. So that's all about all the recall questions. So I think there are almost around 12 questions. In those 12 questions, we have like 11 questions which are asked from our workbook series. In those 11, almost like 7 or 8 questions, or from 7 or 8 questions, they are from MRB workbook series, and as well as question bank, MRB question banks, which I already told you the question numbers also, MRB practice paper recall challenge, MRB subject wise test, and the remaining 4 questions, they are from regular what you call area Texas regular workbook. So that's all about this pharmacology part. So that's all. Thank you so much. Thank you all.